Good evening, and welcome to the third edition of Breast Cancer Action Month, a month long campaign focused on various Indian states. And this is an initiative by Integrated Health and Wellbeing Council, powered by Novartis, and knowledge partner is Rapid Global Cancer Alliance. This session is focused on the state of Kerala. I'm Ridhi Lakra, Assistant Editor, IHW.TV. Breast cancer is the most common malignant disease in Indian women. Yet, despite its prevalence, most women are still shy away from conducting self examinations for signs of breast cancer, as per a study. And in the state of Kerala, while only 46% of the women, when they were surveyed, it was said that they never conducted a self examination for any sign of breast cancer. While awareness about the disease is there, but it is important that we talk about screening for breast cancer. And especially today, we would be talking about the risk factors in the state of Kerala. Joining us for the discussion, we have with us today Dr. Bipin Gopal. He's the Assistant Director, Health Services and State Nodal Officer, NCD Program, National Health Mission, Government of Kerala. We are also joined by Dr. Rona Joseph, P., Assistant Professor, Department of Medical Oncology, Regional Cancer Center, Trivandrum. We also have with us Dr. Midun Chako John. He is a medical oncologist at the Jubilee Mission College, Trishul. Last, we have Dr. Varun Rajan. He's a consultant medical oncologist, Department of Medical Oncology and Hemato-Oncology, Medical Trust Hospital, Cochin. I welcome you all for this panel discussion. And I would like to start with Dr. Bipin. And I hope the other two panel members are yet to join. In the meanwhile, we'll start the panel discussion. Dr. Gopal, I want to start you with the one of the important question. What I want to ask is, like in the state of Kerala, it has reached a very remarkable success in terms of the communicable disease, the prevention, like in the maternal and the child health. And overall, in the past 30 to 40 years, we have also seen non-communicable diseases such as cancer, which has emerged as one of the public health challenge. So, can you help our audience understand what are the steps the state has undertaken and or like how currently it is undertaking to address the women related cancer, particularly the breast cancer?
At the outset, let me thank the HCA Council for giving me an opportunity to speak on behalf of the Kerala Health Services Department. And answering the question, you have very well said that the communicable diseases and the RCH issues have actually come down in Kerala. And now the non-communicable diseases are actually going up, including the cancers, stroke, cardiovascular diseases, diabetes, and hypertension. So we have a well-arranged program called the State NCD Control Program, which is managing the diabetes, the heart diseases, that are the hypertension, the stroke program. But cancer has been a challenge for all of us because the cancer rate in Kerala has gone up in the past years. With if you look at the female cancers, the breast cancer has gone up in a big way. The second one is the thyroid cancer, and the third is the uterine cancer. And if you look at the male cancers, it is the tobacco-related cancers like the oral cavity cancer and the lung cancer, which is on the higher side, and leukemia on the third side. And if you look at the programs which has been done to control the cancer in Kerala, I think Kerala is the state which has the highest density of any cancers in India. And to identify the cases in a much early stage has been a challenge throughout these years. We have developed the district cancer care centers where the cancer management is provided even at the taluk level hospitals. We have trained our doctors, we have set up the district cancer care centers, but the issue is that we are getting the patients at a much later stage. So what we require is the community level detection of these cases. So now Kerala has realized this problem, and now we have started the community level screening for cancers. And this community level screening is done with the help of Regional Cancer Center Trivandrum and the Malabar Cancer Center at Kannur, where we are utilizing the services of the ASHA ASHA volunteers to do a community level survey using an application which was developed by eHealth. And that application is called Shaili. And the ASHA worker will go to every household in her jurisdiction. She will have nearly 500 to 600 houses in her jurisdiction. She will just ask the questions which are developed by the RCC and the NSTD division. And based on that questionnaire, if the patient has got a risk factor for any of the cancers, basically the 3 cancers like the breast, cervical, and oral, that patient will be referred from the community to the primary care center for early screening. And at the primary care center, we are providing screening facility for breast cancer, cervical cancer, and the oral cancer. And if any diseases or actual disease is suspected, this patient will be sent to the taluka level hospital or the district level hospital for confirmation with investigations like mammography, ultrasound guided FNAC, or any other related test. So this is the pattern now which is followed in Kerala. And when we screened nearly 36 lakhs people in 14 districts in 140 panchayats, we could find out 2 lakhs patients with any symptom of cancer. And out of that, the majority of the cancers which were suspected was breast cancer. So this is a good initiative because we can find out the cases at a much early stage, and the complications which are due to the late identification of the cancer of these diseases can be much simplified or eliminated. So that is the activity which is done by the Kerala Health Services Department at present.
Thank you, Dr. Gopal, for giving a instant brief, how the state of Kerala is working towards small initiatives to create awareness amongst the women. And you also mentioned about how the ASHA workers are working locally to make understand women, and also about this e-application. Dr. Midun Chakko, coming to you to understand how can we strengthen the efforts of breast cancer surveillance in the state of Kerala, and given that there are no standardized approach to the screening, how can we improve that?
Yeah, as such, there is no standardized screening in any part of our country, actually. There's no standardized guidelines to suggest. First of all, the most important thing in breast cancer screening should be the self-breast examination, or what we call the breast awareness. Rather than any screening test, like the mammography that we routinely tell about the screening test, the most important part of detecting cancer at an early stage is the breast awareness, the self-breast examination. If there is any change in your breast, or any lumpness or any discharge, you should go and seek the help of a medical doctor. That is one important point. And another point, when we are thinking about screening, we all know maximum literacy is seen in Kerala. Most of the patients are literate, and most of them, with the current social platforms, most of them know about malignancy, breast cancer. Many of the patients, what we usually see is that many of the subjects doesn't come to the doctor fearing that it might be cancer. They know that there is a lump in the breast, it might be cancer, and because of that fear factor, they are many times it may not be cancer. So any lump in the breast may not be cancer, but we have to test it out whether it is a malignancy or not. Because as Dr. Bibin sir has already told, if we find cancer, especially breast cancer, at an early stage, almost all the breast cancers can be cured. If we see the Western literature and our literature, in the Western literature, most of the breast cancers are diagnosed at a very early stage. But in our country, unfortunately, most of the patients comes to us at least in the stage 3, and many of them are even stage 4. The early stage, very small lesions like the 1 centimeter lesions, very small lumps that are malignancies in the early stage. The early stage breast cancer usually doesn't come. It's not like that we don't see any early stage breast cancer, but nowadays it's coming. But still, many of the patients coming to us are coming with a stage 3 or stage 4 cancer, which is very high as compared to the developed countries. So what we should know is the self-awareness and the symptoms of breast cancer. This I means very much like to emphasize is that the breast cancer symptoms, most of the patients tell that they have a breast lump, painless breast lump. So they didn't seek the help of any doctor. So that is one mistake that you should never do. That's a painless breast lump malignancy. Painless breast lump is the most common first symptom of malignancy, and most of the malignancies in the initial stage doesn't have any pain. So that should be kept in mind. So the most important step in the screening is the self breast examination. Rather than doing any, doesn't require any cost. I think most of the females about 25 years should have an awareness about their breast, should do a clinical breast examination every month, a few days after their menstrual cycle, their menstrual periods. They should get the self-examination. And with this, any change in the breast can be easily understood. And if required, they can do a clinical breast examination by a medical attendant. That is usually not required. But the most important part of diagnosing the breast cancer at an early stage is the breast awareness or the self-breast examination that everyone should start at 25 years of age. It's very simple, nothing to be done. And as initially discussed, it's the most common cancer. Around 10% of all cancers are breast cancers, which can be diagnosed at an early stage without any test actually. Because self-breast examination, we can feel the lump. Many times, even with self-breast examination, very rarely we don't feel any lump, but patient can have malignancy. But most of the patient, more than 90%, we can see the lump, we can feel the self-breast examination. So the need for self-breast examination should be emphasized. Together with that, screening methods. Usual screening method with a patient having an average risk can start the mammography, which is annual mammography. Usually in the developed countries, they do at 40 years, 40 to 65 years, we can get an annual mammography done. And what they usually do is that after 65 years, if there is no high risk, they do it every 2 years. But in our country, with the cost constraints, it's not possible to get the annual mammography for all subjects after 40 years. So at least get the mammography for those patients of above 45 years to 65 years. At least annual mammography is not possible at least every 2 years. And in those patients with high risk is especially in those patients having some atypical lumps, biopsy taken, causing not malignancy, but some atypical hyperplasia or a definite high risk of family history, they should get their annual mammography done. What we usually say is that from 40 years, if there is patients having a strong family history, or 10 years before the first index case. So if a patient is having mother had breast cancer at the age of 40 years, they should start screening 10 years before at least the first index case. So they should start screening at 30 years. So if the patient had 55 years breast malignancy, their relatives should start either 10 years before 40 years, whichever is earlier. So that is the usual, and we should get an annual mammography for 65 years, and then we can change to every 2 yearly. So that is the screening method by which we can actually diagnose breast cancer at an early stage. And diagnosing breast cancer at an early stage means almost all the cases can be cured. So definitely with this screening method of self-breast examination, clinical breast examination, and mammography, most of the breast cancers can be diagnosed at an early stage.
Thank you, Dr. Mithun, for that. And as you mentioned, self-examination is one of the key here, and to understand whether a woman has breast cancer or not at a very starting level. Dr. Gopal, coming to you in the same lines, like Dr. Mithun was talking about, like how examination is important, and then the screening is there. Like if you could tell, like what are some of the challenges in implementation of the routine screening in the state of Kerala, and in terms of breast cancer screening, and what are the challenges the state is facing, and how do you think, some of the, if you could say, like tell about some of the strategies to overcome them, and how is the state doing it currently?
Yeah, the screening is always a challenge for cancers. Like what Dr. Mithun has told, the cancer phobia is very much there in the state. People are afraid to be branded as cancer patients. And that's the reason why most of the people, most of the suspected patients are not willing to come to a doctor for the screening of cancer, even if they suspect some kind of a cancer. And that is the major challenge that we find in all the cancer screening programs. So whenever we say that this is a cancer screening camp, people are quite afraid to come to that camp, and the attendance is quite very low in these camps. So what we are doing right now is we don't brand these camps as cancer detection camps. We name that as the NCD camps. And as a part of the NCD, we are doing these tests for you. And um, the biggest challenge is the neo-awareness or the semi-awareness of the people. People are 93% literate, so they read and write. They hear from every possible health magazines or health other literatures. So any small thing, they will be suspecting the maximum side effects or the differential diagnosis, which can be most fatal. And to overcome this challenge, the Health Department of Kerala is trying to educate the people about the positive aspects of early screening. And that education actually comes through the ASHA workers who are working in the field, the middle level supervisors, the staff nurses, the junior public health nurses or the ANMs who are working in the field, the Anganwadi workers. And we are also using the arm of the Kudumbashri, which is a self-help group for the women, which has a 45 lakhs participants in the state. And we are preaching the benefits of the self-help, self-breast examination, so that the awareness of breast cancer or the early breast cancer detection reaches to the public. This is a very big challenge for as far as the health department is concerned. And we are also seeking the help of NGOs in this sector who are working in the field level, because this is a challenge which should be tackled much early to prevent the deaths and the morbidities due to cancer. And the methods which we are taking is, one is health education, and the second one is intensive screening, and the third one is the population-based screening, which I mentioned in my previous session, community-based screening using a questionnaire. So the importance of this questionnaire is that when somebody asks you a question, do you have a history of breast cancer in the family? Are you nulliparous? Are you having a lump somewhere in the breast or in the axilla? Do you feel pain? If some leading questions are asked to a patient, they will immediately say, okay, I have that symptoms. And once that patient says it's positive, that patient will be referred, that subject will be referred from the community or mobilized from the community to the screening center. So like that, we are doing a one-to-one campaign utilizing the peripheral health workers and mobilizing the people for an early screening. But simply saying that you should do a self-breast examination is not actually working out in the state of Kerala, because the level of consciousness, the level of health awareness that people do have, that is preventing them from testing for cancers. That's the biggest challenge that we do have.
Thank you, Dr. Gopal, for like very important thing. Like a lot of states, any woman would be scared to go and do a test, or maybe when, as you said, if there are screening camps also, people would be scared to walk in and get themselves tested. And if they come to know that they have breast cancer, that would be also very difficult for them to understand, like in an easy way. But I hope this challenge is being tackled very soon, and we have much better solutions to talk to people, maybe through, as you said, about through the ASHA workers or maybe the local NGOs, how they are working. They can interact with the people, make them understand about it. I hope Dr. Varun is here. If Dr. Varun, if you can hear me. Uh,
Yes, I can hear you.
yeah. Dr. Varun, could you, like, if your camera is working, like, we would request you to switch on your camera as well.
Yeah, actually, my camera is switched on now. Am
Not
I
yet, Doctor.
visible?
No, no. No, not yet. But I think doctor is not here. Yes, Dr. Varun, like if you can hear me, and so like as we were discussing with Dr. Gopal and Dr. Mithun about like how the state of Kerala is seeing like observing breast cancer, and it has like a lot of you also as a working practitioner, you might have also learned about the prevalence of breast cancer in the state. And how do you think, how eager are people to come forward? We were discussing about the screening camps. So, like, as your experience, do you think people are eager to come forward and talk about the screening process? Have you seen any specific trends in any of the community as a whole if you are working somewhere?
Sorry, actually, the question to me.
Pardon me, doctor, I didn't get what. So I was
Am
asking,
I
like,
audible?
you, yes, yes. So I was asking, like, do you think the people in Kerala, like where you have been working, so people are aware and are eager to come forward to talk about breast cancer and about the screening process? And have you seen any kind of trends in the community as a whole, that the entire community is talking about it? They are talking through their maybe social media, they are talking through the community groups and all. Have you seen any sort of a trend? And if you could share something.
Yeah, of course. And it's actually all of you consider Kerala as a 100% literate state, right? But still, concerning the cancer literacy, it is still lacking, or it harbors much stigma about all type of cancer screening. No, actually, yeah, in the metro cities and all, actually, it has changed some way. And in those patients with higher, in those individuals with higher socioeconomic status and all, actually, we can easily convince them to do a routine mammogram and all. But still, the majority of the population are still out of that area. Because if we tell them to do a screening mammogram, actually they usually first consider it as an unwanted thing, or actually they are more concerned about the side effects and all, actually side effects of radiation and all these misconceptions will come. So I think actually mainly actually we have to build a culture of about this breast cancer screening and the importance of being breast aware. So this breast awareness is very important, particularly for young ladies and the teenagers and all, because we have to start the screening and this culture from the teenage itself, from the age of 20 itself. So I think it is better to start this awareness program from schools and colleges. And also, of course, this community-based awareness is still valid, but still, actually, if we can actually, if we can convince or if we can educate the young girls, actually, not only the girls, all the young individuals, those who are studying in colleges and schools, both boys and girls, because actually we can make them as the ambassadors of breast cancer screening, because they'll go to their home and they will encourage their parents or their aunties to do the screening program. So actually we can use them as volunteers also, because they are very enthusiastic. If we can them for screening and the early detection. So I think that type of strategy will work more than the thing that we are doing now. And also again, the social media is so we can use the social media platform for making this breast cancer awareness and the importance of being breast aware and all sort of things. I think that type of strategy will work more than the conventional type of the programs. And actually, one more thing, no, even among the doctors itself, actually, this stigma is still there. That is actually, if you talk to a doctor community, if you ask them whether actually are they doing the screening of their families, because as majority of them are not doing. So this stigma is there, irrespective of the profession, then socioeconomic status, and the area where they belong. So a mass strategy actually will only work. So yeah, it is my take about this.
Yeah, thank you, Dr. Varun, for highlighting a very interesting and bringing up a very important point that how younger children and from the college and all can become the ambassadors of breast cancer and become volunteers to tell about the disease to their families and their aunts about the disease. And that's a very good initiative. I think that would be a very good initiative. And as you said, social media is playing a very great role. We see a lot
we
of
can use the school teachers and college teachers because they can influence large number of people, their students, and all. So we can use apart from the ASHA workers, we can use the school teachers, college teachers, paramedical staff, school students, college students. Yeah.
Yes, doctor. Thank you, Dr. Varun, so much. Dr. Mithun, coming to you, when we talk about in the urban culture, like it is said that are most of the urban women more susceptible to breast cancer, and what are some of the prominent risk factors? When we talk about the risk factors, are there some prominent risk factors? And what do you think can some of the strategies and initiatives that can be implemented to make women aware about the breast cancer?
Yeah, means the risk factors as such, we all know the breast cancer is on a rise, and the risk factors are basically because basically nulliparity, increased hormone secretions in the body. The patients are living a sedentary lifestyle. Of the all subjects, all the general population are going into this way. So obesity, a sedentary lifestyle, nulliparity, these are all increased risk factors, and definitely family history. Family history is one point. We all tell that cancer is not a hereditary disease. Definitely cancer is not a hereditary disease, but 10% of breast cancer can be hereditary. So high family risk can be hereditary as well, and also same family members will have almost the same risk factors. So these all can cause. So these risk factors should be identified, and the general population should move towards a healthier lifestyle. Lifestyle modification as decreasing other non-communicable diseases like hypertension, diabetes, the heart disease, coronary artery disease, all get decreased with the healthier lifestyle. So similarly, a healthier lifestyle decreases the cancer. When we tell that a general population who is having a lifestyle, have a sedentary lifestyle, who eats good food, green leafy vegetables, a lot of fruits, they have much less chance of developing cancer. So lifestyle modification is quite important in prevention of the cancer as well. And another point, which means, as everyone has pointed, Dr. Varun, Dr. Gopal also pointed, is the fear factor of developing cancer. That's very high even among doctors also. So as Dr. Varun has already mentioned, many of our fellow doctors or colleagues are also not undergoing any screening test. So if we check in the hospitals or any nursing staff or anyone who are themselves are undergoing any screening test, most of them, percentage are not undergoing any screening test, even with all the facilities, even with knowing all the risk of cancer, early diagnosis of cancer can cure almost all diseases. Most of the doctors who are well educated know all the risk factors, all the problems of diagnosing cancer at an early stage. Most of them are also not undergoing any screening test, not only breast cancer screening, any screening. So that's one thing that we should always keep in our mind. And this cancer fear, this fear of developing cancer, the fear of cancer treatment, that should go out of our mind. Because when we think about cancer, most of the patients as well as the general population think it as a non-curable. Once you develop cancer, you're branded a cancer patient and you will never come out of it. It's not like that. Most of the patients get cured of cancer. So curing the cancer, the most important thing is diagnosing it in early stage. So the screening methods hold a lot of importance. So as I've already mentioned, self-breast examination and the mammography holds valid point in diagnosing the breast cancer at an earlier stage. And also importance should be given to the cancer prevention. So cancer prevention, living a healthier lifestyle, so that actually decreases the incidence of cancer. Tobacco-free, regular exercise and eating a lot of vegetables and fruits decreases the cancer. So that's one thing that should be inculcated the school children onwards. So eating fast food can cause cancer. That should be kept in mind.
Thank you, Dr. Mithun. Dr. Gopal, I want to come and ask to you, like Dr. Mithun and both Dr. Varun were both talking about like how we can create awareness, and one of the important things is of the lifestyle factor. But there is another, there was a data which came out from the National Health Survey. Like it came that only 2.4% of the women have gone for breast examination in Kerala. How would you describe the attitude of the women in Kerala regarding the screening? And also there misconceptions, though we are taught about like a healthy lifestyle, we are taught about like maybe through the small campaigns which is happening, but how do you think that there is like in the state of Kerala itself, like if we are talking, are there women who I mean they are not ready to accept this? What is their mindset? And are there misconceptions around the screening process? Like as Dr. Mithun was telling, like going for a yearly mammography, I'm sure a lot of women would be scared about like a normal X-ray. Like, why would I go if I do not have anything? Why would I go? So, are there misconceptions as well around breast cancer in that way?
Definitely, yes. Even though the state of Kerala is highly literate and the literacy is also quite good, like what Dr. Varun has said, cancer literacy is something which is very lacking in the state of Kerala. There are many misconceptions about cancer. And the first misconception is that cancer is non-curable. Exactly like what Dr. Mithun Chakko has said. Because the technological advancement, the therapeutical advancement in the field of cancer has made cancer treatment quite very advanced, and many patients are getting cured after if it is detected quite early. But this fact is actually not imbibed into the minds of people who still thinks that cancer is an end-stage disease. And not only that it is an end-stage disease, it is going to make your economy crumble. Because once if you are detected of cancer, if you're going for investigations, if you're going for a management, then your economy is going to be doomed. And due to this misconceptions, people are quite not willing to do a cancer screening. And that's the only reason why people are not accepting the fact that an yearly screening should be done for an early diagnosis, because they don't want to get diagnosed. They feel like it is not me, I am not the one. They feel it is somebody else's disease unless they are found to be screened or diagnosed. So that kind of a misconception, that kind of a reduced awareness about the consequences, it's leading to the poor screening in Kerala, even though the health literacy, the average literacy, especially the women's literacy, is quite high in Kerala. And the second thing is that the promotion from the government side for a regular screening, as we see in the West, that there should be an annual checkup for cervical cancer, there should be an annual checkup for oral cancer and breast cancer for every woman. Such kind of a policy is not there, just because of the fact that the population density is quite high in Kerala. It's very difficult to have all the people screened in every year. But at least we can consider the people in the risk group for an annual screening or an annual checkup. So such things should come as a policy, or at least the working class, the working women who are working in the most stressed atmospheres, they can be subjected to the cancer screening by the government or by the company which they are working. Similarly, the school children can be educated, like Dr. Varun has mentioned. So the overall policy of the government, of the health department for an early screening needs a little more reinforcement. Then only people will feel that, okay, this is my health and this is my responsibility, and the government is providing a facility to do this, and we can utilize that. Now there is a lack of facility. People have to stand in queue in the RCC or the medical college for a routine checkup and all. So people get fed up easily. So if we can tackle all these things, definitely, I think Kerala will come up in early breast cancer screening.
Yes, Dr. Gopal, we also hope so that the state of Kerala would be an example for the other states as well, to create much awareness about, like we see a lot of campaigns and viral videos which come from Kerala, and people are inspired from the state of Kerala. And we hope very soon we would have something interesting on maybe breast cancer as well. Dr. Varun, coming to you, in the same lines, there was another Dr. Varun, if you can hear me. So there was another data like which was shared at the Lok Sabha in the response, like it shows the highest age adjusted rate of breast cancer incidence that was found in Kerala. Like Doctor, what do you think would is the main reason for high number of breast cancer cases in younger women? And are there any specific reason that more younger women are getting breast cancers now?
So majority of the cases are mainly due to the change in lifestyle, because majority of the younger women in Kerala working now, and mainly that is the risk factors of breast cancer, actually the late age of marriage, then the first child, then absence of breastfeeding, the nulliparity, because all these are risk factors. Then obesity and sedentary lifestyle. So most of the females in Kerala are mainly actually employed now. Actually, they are working. Yeah, actually, mainly a desktop type of jobs. Actually, mainly they are doing. So actually, the lack of exercise, then and also hormonal factors also contributes to the increased risk of breast cancer in Kerala. And of course, the detection rate is also much higher than the other states.
Thank you, Dr. Varun. That is like a very important thing. Like a lot of, the hormonal issues. The lifestyle is also one of the important factor which is affecting a lot of women, younger women. They do have cancer, and I hope we have some sort of awareness regarding this, that this can be reduced. And as Dr. Midun Chako was also explaining, that lifestyle changes can bring a very important change, and we can work on those lines. Dr. Midun, coming to you, when we talk about strategies, it is very important that we start creating awareness at the very young age. Dr. Varun also said some of the lines, some of the important points are like how school education, college education, they can become, the children can become ambassadors. So if you could suggest what as a state of Kerala can do to come up with some better strategies in terms of the screening process, how they can create awareness about the screening process, the lifestyle change modifications one can do. if you could tell something on those lines.
Okay, so regarding this, all the non-communicable diseases, not only cancer, the awareness, as Dr. Varun and Dr. Gopal told, it should start from the school time. So this should be made mandatory regarding, they should have a mandatory class regarding the lifestyle modifications that help in decreasing the non-communicable diseases, especially diabetes, hypertension, coronary artery disease, heart diseases, and malignancy. Because we all know Kerala is going to be the diabetic capital of India. The percentage of population having diabetes is very much high. And diabetes, obesity, all are interlinked. And this can directly cause increase in the malignancy as well. So not only the cancer diseases, other diseases all. So all these things should start from the school time itself. So all the children should be educated regarding these diseases, because in the younger age, they are not problems. So, but all these risk factors, all these dietary problems, all these sedentary life habits start from the school time itself. So it is at this younger age, we should actually implement these things, and so that these all these risk factors accumulated over 10-15 years is going to cause cancer. It's not like we have a risk factor now and tomorrow it's going to the patient is going, or any subject is going to develop cancer. So it should start from the school time itself. It should be made part of their curriculum regarding the lifestyle modifications, the physical exercises that should be made part. It's all made part, but we all know after 8th, 9th, they go only for the education part, and the other sports activity, all the extracurricular activities is gone. And they should also be taught about eating right, drinking right, and also regarding the addiction part. So these all things should be made part of the curriculum. And it is at this tender age, we should start teaching them regarding all these screening methods, all the self-breast examination. As Dr. Varun already mentioned, that these children are very enthusiastic and they will actually teach all their relatives, all their nearby neighbors regarding the screening methods, what all screening test has to be done. And we all discussed about the fear factor of breast cancer. So this fear factor should be taken out from their mind at the younger age itself. So teaching them all these things, because even doctors, they know that there are the doctors having a breast lump come to us very late, because they know that it's cancer. They fear that it's going to be an incurable disease, and many a times they come at a later stage itself. Even doctors come at a later stage. So that fear factor should be taken out. It's not like today we are telling that cancer is curable and everyone is going to believe, but it should be starting from the school time itself. And the basic screening methods, all the screening tests, that should be taught in the colleges and schools, at least from the 9th, 10th standard onwards, in all degree colleges, all the postgraduate, these things should be taught actually. So this is to change life. This is going to means the test, and also taking the help of the in a bigger scale. Directly the patient coming that are you having a breast lump? Are you having any family history? So we can actually give the mark and put them into high risk. In our cost constraints, screening everyone is not possible in our country. With such a population, it's not possible to screen everyone. So at least screen those individuals who have got a high risk. These should be done, and the importance of screening and self-breast examination should be taught from the younger age itself, so that these changes can be found out in their later life, and they can actually prevent cancer or diagnose cancer at an early stage, and also prevent all other non-communicable diseases.
Thank you, Dr. Mitten, for that. And I think this is like a very important thing. We, as like all the panel members, also were telling about this earlier, that we need to start this at a very young age. Teaching the younger children would be, I think, the key here to make them understand that breast cancer, and even the not even breast cancer, even the other cancers as well. We need to talk about it, and that's the way we can come out about talking about the cancer, and then yes, the screening process would become easier, and that early treatment would also become easier for everyone. Dr. Gopal, coming to you, Doctor, do you think making cancer a notifiable disease in the state has helped in plan allocation and utilization of health resources for cancer control and even prevention? And what more needs to be done to strengthen the system of cancer and even the breast cancer care? Dr. Gopal, you are on mute.
Yeah, regarding the cancer notification, even though the government has given orders for making cancer notifiable disease in the state, that has actually practically not happened so far. We are still in the process of doing it, but that will help in plan allocation, that will help in earmarking funds for cancer care, that will give a justification for funding, for allocating more funds for cancer. Definitely that will happen, but that is not enough, because the out-of-pocket expenditure for a cancer management of any woman or any person who is having a cancer is quite high. This is a fact that we should all understand, because even an APL patient who is becoming a cancer patient can become BPL at any point of time. So that is the cost of treatment, which cannot be reimbursed or subsidized by a government, because even in the regional cancer centers of Trivandrum, Kochi, or in Calicut, these are all autonomous institutions where people have to pay an amount. So cancer treatment is not actually that free for any person, even if they are BPL. There are schemes by government. There is the Karunya Arogya Suraksha Paddhati. There is a Karunya scheme. There is a cancer management scheme of the CM. There is an RBSK scheme. Even though there are schemes for providing cancer treatment, I think the insurance part for a cancer treatment should be enhanced. Then only the people from all sectors of life, from all economic stratas, they can come boldly for a treatment. So making cancer a notifiable disease is one part of actually making a good database, but the actual thing is the financial thing, because if only we make the cancer management affordable and accessible to the people of Kerala or any country or any state, then only the management, the control rates also will be in a satisfactory position. And the second thing is the accessibility part. We are providing quality care at Regional Cancer Center Trivandrum, which is at the southern end, at the Kochi Cancer Center at the middle end, and at the Malabar Cancer Center, which is at the northern end. In between, the gap is filled by medical colleges and also by the private sector. But as we all know, at the private sector, the people who can afford only can get the management at a reasonable level. And majority of the poor patients who cannot afford to go to a private center, they are depending on the government sector. So the reach of these centers should be more decentralized. People cannot go from one district to another district for cancer treatment. That is increasing their financial burden. That is increasing their physical difficulties. That is increasing their emotional difficulties. So that's the reason why we have decentralized the cancer treatment from the cancer centers to the district level hospitals and the taluka level hospitals. Now we have 25 such centers which are functioning, and we should make that universal, so that people who are diagnosed of the disease, people who are put on treatment, can avail the follow-up treatment at their near to their residence or at their district itself. So by making the cancer management affordable and accessible, I think we can work wonders.
Thank you, Dr. Gopal. We are almost here at the end of this panel discussion. Like as a closing note, I would request all three of you to give your closing remarks on this. That how can we create more awareness amongst the women about the early screening, and we can enhance the diagnostic process in the state. Dr. Varun, I would like to start with you. Your takeaway points from this panel session.
Yeah, for this breast cancer awareness and screening, it is not only the responsibility of a female or a lady, it is responsibility of the entire family or the society. So we have to give the direction like that. So it is the need of the entire family and or subsequently society itself. So we have to create awareness in that way. So that's why we have to create awareness among the children, and also actually among males also, the husband, then the brother. So all family members we have to create awareness, and we have to approach in a multi-dimensional way. That's all from my part.
You're muted, madam.
Dr. Mithun, your three takeaway points. Dr. Mithun, can you unmute yourself?
Yeah, sure. So actually, it's very difficult to give three takeaway points, but definitely, I think lifestyle modification, living a healthy lifestyle, self-breast examination, if required, mammography. That should be the point. And don't fear cancer. We can.
Dr. Gopal.
Yeah, first is increasing the health education, cancer awareness, so that motivating the people to come for cancer screening. That is the first point. Second point is that making the screening facilities universal, so that people can have an easy accessibility to the screening centers. And the third one is affordability. When you diagnose cancer, make some schemes or provide some facility so that the cancer treatment part is made affordable to that patient. And one more thing to add on, the psychological support the people will have. We should manage the psychological aspect also of every patient who is coming for screening as well as who is diagnosed. Thank you.
Thank you so much for joining us today, all three of you, Dr. Gopal, Dr. Mithun, and Dr. Varun. And on behalf of the IHW Council, I would like to thank everyone for joining this panel session. And I would like to take a special thanks to Novartis for taking this initiative, and our knowledge partner, Rapid Global Cancer Alliance. This is a very great initiative that we talk about. And in the state of Kerala, we hope the state of Kerala and along with the other states, we work together in creating an awareness about breast cancer, and more women would come forward for doing their self, maybe start from the self examination, and then they can come early for the treatment process. On behalf of ISW Council, I would like to thank everybody for collaborating and creating awareness about breast cancer. And we hope we all create a better nation for good health. Thank you, everyone, for joining. Have a good evening.
Thank you. Thank you very much.
Thank you, Doctor.
Yeah, thank you.
Thank you. Good evening to all.